question is that the total sum to be allocated for head O of the estimates be reduced by $100. Ms. Ng Ling Ling.
Mr. Chairman, first I would like to declare my role as a consultant in healthcare transformation. So when a person falls ill and needs to see a doctor, primary care is often the first line of care in a community that they think of. It is an important line of defense, and primary care family physicians play a very critical role in caring for patients for non-emergency needs, preventing acute hospital episodes where possible, especially seen during this COVID-19 pandemic period. Many developed countries around the world attempt to provide proactive primary health services instead of reactive care where a person will only visit a doctor when they are sick. This can improve population health in general. In the United Kingdom, more than 99% of residents are enrolled with their general practitioners or GPs that will provide health screening and follow-up care within 6 months of their enrollment. This practice shifts the focus from treatment of acute and chronic diseases to disease prevention and early management. With our chronic disease prevalence continuing to rise with our rapidly aging population, this form of comprehensive primary care delivery may be beneficial for our population for several reasons. Firstly, a person is enrolled to a GP. It allows both the doctor and patient to establish a long-term care relationship together. Furthermore, early screening and diagnosis can also help in better management of chronic diseases, rendering it more cost-effective in the long term by avoiding complications and reducing needs for hospitalized care. A point to note is that to anchor health delivery in the primary care and activating more GPs to engage in preventive and chronic disease management, GPs will have to assume more responsibility for long-term health and well-being of their patients that they are serving. This is likely to have additional workload for GPs as they would now have to monitor and provide follow-up care for more. This is especially important to note as we know that many GPs have already stretched themselves to support the fight against COVID-19 pandemic. As such, I would like to ask if MOH will consider providing more resources and incentive to encourage GPs to step up in preventive and chronic disease management to enhance healthcare for our aging population.